Addiction is not just about substances, it's about patterns, unseen forces that can control behavior, often without conscious awareness. But what if understanding these hidden triggers could be the key to lasting recovery? Addiction isn't as simple as craving a substance or needing a fix. It's often driven by complex patterns that are buried beneath the surface. These patterns can be rooted in trauma, emotional pain, stress, or even subtle habits that have become automatic responses. To truly break free from addiction, it's crucial to identify and understand these hidden triggers and learn how to respond to them differently. Triggers are often subtle. They can be sensory, a certain smell or sound that brings back a memory. They can be emotional, feelings of stress, anxiety, or even loneliness that urge you toward old habits. Or they can be situational, certain people, places, or routines that act like a switch, activating the craving for substances. But one thing is clear, triggers operate on a psychological level, often guiding behavior without conscious intent. The first step in managing these triggers is to identify them. Here's how. 1. Keep a trigger journal. For a week, record every time you feel an urge to use. Note the time of day, the situation, your emotions, and any sensory experiences associated with the urge. This log will help you see patterns that might otherwise be missed. 2. Look for patterns in your past. Often, addiction is tied to unresolved emotional pain or trauma. Reflect on what was happening in your life when your addiction first began. Were you experiencing stress, loss, or isolation? Understanding these roots can provide valuable context. 3. Assess your environment. Consider your daily surroundings. Are there people, places, or situations that consistently lead you toward cravings? If so, it's time to think about changing or limiting your exposure to these triggers. Understanding your triggers is only half the battle. The real power lies in transforming your response to them. Here are some effective strategies. 1. Mindfulness training. Mindfulness is a powerful tool for rewiring the brain's reaction to triggers. Instead of automatically responding with substance use, mindfulness teaches you to observe the craving, accept its presence, and let it pass without acting on it. The more you practice, the weaker the triggers become over time. 2. Cognitive behavioral techniques. Cognitive behavioral therapy, CBT, is highly effective in addiction recovery because it helps reframe negative thought patterns. When you feel a trigger, pause and challenge the thoughts driving it. For example, if stress is a trigger, ask yourself, what's another way to handle this stress that doesn't involve using? 3. Build alternative coping mechanisms. If stress, boredom, or loneliness are common triggers, focus on healthier outlets like exercise, hobbies, or connecting with supportive friends. These new behaviors won't just replace the old ones, they'll create new, positive neural pathways that weaken the power of the triggers. This might sound counterintuitive, but your triggers can actually become your greatest teachers. Each time you recognize a trigger, you're given an opportunity to learn more about yourself, your vulnerabilities, your emotional needs, and your hidden strengths. By actively engaging with these triggers, instead of trying to avoid or suppress them, you gain insight and resilience that are crucial for lasting recovery. Here are a few real-life examples of individuals who have confronted and mastered their triggers. 1. Melissa's journey. Melissa's addiction to alcohol was deeply tied to stress from her demanding job. Through journaling and mindfulness, she identified that her cravings spiked after difficult meetings. She began practicing deep breathing exercises and took 5-minute walks instead of reaching for a drink. Over time, her cravings became less intense, and her confidence in handling stress grew. 2. Tom's transformation. Tom's heroin addiction was linked to unresolved trauma from his childhood. Working with a therapist, he learned to recognize triggers rooted in feelings of rejection. He replaced old coping mechanisms with journaling and therapy, which helped him confront the trauma head-on and reframe his relationship with rejection. 3. Lila's new routine. Lila's trigger was boredom. She used substances to fill the empty hours. By actively filling her days with hobbies, volunteering, and even learning a new skill, she shifted from avoiding boredom to embracing new, fulfilling activities. Addiction recovery isn't about eliminating triggers altogether. That's unrealistic. It's about transforming your relationship with them. By seeing triggers not as enemies but as signals, you begin to take control. Triggers are no longer roadblocks, they are opportunities for growth. Understanding and overcoming these hidden patterns requires patience, self-awareness, and commitment, but it's possible. Every time you recognize and respond differently to a trigger, you're not just resisting addiction, you're actively building a stronger, more resilient self. And that's the real victory.